The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited to have with us on the program today a dentist. You know how much I love it when they come on the program to share. Dr. Pasco, say hello to everyone.
Hi, everyone.
Thanks for taking the time to share with me, share with our listeners. Again, we really appreciate it. Why don't you start where we have everyone start? Give us a little bit of background. Tell us how you got involved in dentistry.
Oh, sure. Yeah. I've been a dentist for 26 years. I just recently retired. Over that 26 years, I did dentistry about 50% of the time and owned and ran my own multiple location dental practices, the other 50% and consulted and trained other dentists during that other 50% of the time. I got into dentistry because I was a patient. I really had my heart, no pun intended, but my heart set on being a cardiologist. And I was in a dental office getting a cleaning, and the doctor came in to do the exam, and he asked me what I was studying. I told him, and he said, you should consider dentistry. It's a great profession for women. You don't have to be on call. It's not as stressful, and so I said, ew, gross, that's disgusting, no way. And he said, well, why don't you come into the office? You can just kind of shadow for a day and just see what you think. So I did, and he was doing like a veneer case or something of that nature, something cosmetic. And at the time, I realized that it was a perfect combination of art and science, which I love both. And so I went down that path. I applied to dental school early. I took my chances. I got accepted to the 2 dental schools that do accept early applicants. I chose Pitt Dental, and I went to Pitt. Had a great time there. Learned a lot, and learned also that I still need to learn. And I came out, started my career. I worked for that same dentist for a little while, and then went out on my own.
So tell us, how did you go from opening a practice to getting into the specialty that you're at now? And why don't you talk about that a little bit?
Oh, sure. Yeah. So when I decided to retire from dentistry, I took with me, all of my knowledge from seeing the patients that I saw over the years, and not just my patients, but also observing and working in other dentist offices, being a consultant and going in their offices and helping them. One of the things I noticed was that there's this sort of pandemic that's going on with the human jaw. It's shrinking, it's getting smaller, teeth are more crowded, there's more problems, leads to more disease, dental issues, breathing, airway issues. So when I retired from dentistry, I sold my dental practices. I decided to open up a myofunctional therapy center, and it's called MyoAway Centers for Kids. We focus on using medical grade FDA approved appliances to help develop the jaw structure and airway structures in children at a young age so that they can grow and develop properly and ideally breathe better and live a better life.
Yeah, that's fantastic and awesome. It's great that you're following something that you love. You also love coaching and consulting, right?
I do.
Yeah.
Yes, very much so.
Let's talk about that a little bit. Let's talk about what are some of the major problems that you see that dentists are facing right now. You've got some experience, maybe something new that's really stressing out dentists, that's causing them a lot of restless nights.
Yeah, that's a really good question. I don't know that it's anything new. I've actually been harping on this for years and years. And I don't know if your listeners are going to like what I have to say, but that's okay. I'm going to say it anyway because that's
Good.
just how I am.
Love it.
We're our own worst problem. The dentist is our own worst problem. We are ruining our profession by taking a back seat and not being part of the medical community. We're posed as something different than medicine, something outside of medicine. And I think that's a major problem. And it's something that we have to work on and we have to fix. And it starts with ourselves. It starts with how we portray ourselves, how we present ourselves to our patients, to our staff, and to the medical community. We should be presenting ourselves as a necessary part of medicine, not something that people can get to when they can, or not something that should be not taken seriously.
Sure. I think some dentists have that same mentality internally, right? So they actually kind of feel that way after a period of time too. And I'm not sure why that happens. Maybe you have some um, can enlighten us as to why that happens. But if you do feel that way, how do you go about changing that? What do you do to change that mentality?
Yeah, yeah, that's good. And Patrick, you're right. I mean, I do know what that feels like because when I first went out on my own in practice and I would sit down in front of a patient and I would tell a patient what they needed, they in return would tell me what they wanted, and then I would cave and just give them what they wanted,
Sure.
which was usually what their insurance covers, whatever is least expensive. I didn't always give them what was best for them, which is, what I wanted to do. And time after time after time after time again, that eats away at us. And then you kind of get stuck in this vicious trap, so to speak. The way out is the way through. You have to, as a dentist, as a medical professional, you have to learn how to stay true and solid to your profession and to your diagnosis and to your treatment plan. And what I mean by that is if you're telling the patient that they need a crown and they want a filling, you can't back down and just give them a filling just because that's what their insurance covers more of. You have to stay true to your diagnosis. I try to equate it to, a cardiologist, right? If a cardiologist tells you need a triple bypass and you tell the cardiologist, I really don't feel like a triple bypass. Can you just do like one bypass this year, one bypass next year, and one bypass the year after? I think the cardiologist is going to kick you out. So that's what I mean by, we're kind of our own worst enemy, because we get afraid. We don't want our patients not to like us. We don't want to create or any tension or ruffle any feathers, so we just kind of back down. But that's not what the medical profession does.
I
And if we want to be part of it, we have to stay true to our diagnosis and our plan.
Yeah, I think there's obviously a contrast in the medical profession. If someone literally can't afford something, there's usually some type of a safety net that'll allow them to, right? For instance,
Yeah.
Medicaid, something along those lines, right? If it's necessary, if it's going to cause them immediate death, emergency room has to take care of them. That
Hmm.
doesn't happen in dentistry. I saw yesterday a post that was really interesting that blew up on Reddit, and it was from a orthopedic surgeon who had a patient cancel that a surgery same day, knee surgery. It was a contractor, someone who did physical labor for a living. The reason why they canceled it is they couldn't meet their $5,000 deductible, right? And it's probably a 20, 30, 40, $50,000 procedure, but they literally didn't have the money for their deductible. And the post went on to say that this is ridiculous. Insurance doesn't cover anything anymore. This person's going to end up out of work in a very short period of time. They're probably going to gain a lot of weight. They're probably going to get diabetes, and they're going to die early. That was the post. And it
Yeah.
blew up. You can check it out. It was on Reddit yesterday. I just happened to
Yeah, I
catch it
certainly will.
somehow. What's that?
Yeah, I certainly will. Yeah,
Yeah.
that's
So how
interesting.
does in dentistry, and I agree, I 100% agree. It's a vital part of healthcare. It's one of the most important parts of healthcare, especially for maintenance. What happens there? A patient, needs a crown and they
Hmm.
don't have money, right? Or they need a root canal and they don't have money. What do you do then? I mean, what do you if it's literally life or death situation? Do you do the procedure for free like an emergency room would? What does that look like?
Yeah, yeah, I've been in situations like that. I had a patient years ago come in who was coming out of prison and he had really bad teeth. He needed them all out. He needed dentures, etc. He had been to 4 other dentists who turned him away because he said he didn't have money. So it's a knee-jerk reaction for a patient to say they don't have money. They can usually find the money. And in this case, it was a lot of money. But in the case of a crown with insurances and co-payments, it might just be a few $100s, right?
Sure.
Most people, when they want something or they know they really need it, they will find the money. We took the time with this guy. It took several hours. But we took the time to help him work through where he could get the money from. And at the end of the day, he did come up with the money and he did get better. And several years later, he brought, his main goal coming out of prison was he wanted to look good and start a family, So several years later, he came in with a girlfriend and a baby and, he was happy. And I think it just, you got to take the time, but there are some cases where they don't have the money. It's true. But the problem is we buy into that response a little too quickly in our profession. And I think we have to be willing to stick our neck out a little bit, get a little bit more involved, or have staff that will get more involved to really work to help the patient. If they really don't have the money, there are lots of charity systems. Like in Pittsburgh, we have Catholic Health Charities. That's what we did, is we would refer them there. If it was
Sure.
something that wasn't going to take me long or something I wouldn't be at risk for, periodontally involved tooth that's floating in the breeze, I would just take it out for free and just say, hey, say something nice about me on Facebook. We'll consider that payment,
Yep.
So.
Do you think when it comes to case acceptance, and do you think talking to patients, I mean, this orthopedic surgeon went on to say that, hey, they're not gonna work, they're gonna get depressed, they're gonna put on weight, they're gonna get diabetes, they're gonna die, right? I mean, that's the extreme, right? But it's
Yeah.
possible, right? He believed it, right? At least enough to put it out there. I mean, that can happen in dental too, right? If you can't chew, right? People can end up with diabetes or bacterial infections, or all these types of additional health issues can happen. Do you think dentists are doing a good enough job of explaining that and educating their patients as to what happens if you don't treat this, or are they a little too afraid to kind of shock and awe the patient?
Yeah, to answer your question properly, I would say that I think the dentist is doing too much talking and not enough listening.
Mm,
And I think the dentist is talking about things that they want to hear or that they think would relate because they're talking to the patient like they'd be talking to themselves or another
right.
colleague.
Yeah.
They're not taking the time to pay attention and listen and find out what the cues are and find out what the person's really thinking. So in a case like that, I'd say, well, let's say you let this tooth go. What do you think is going to happen?
Right.
Find out what the patient knows, what they think. Maybe they think, well, my father let his tooth go and nothing happened to him. He's
Sure.
fine. He has no back teeth and he's 90 years old. So this whole idea of losing your teeth can shorten your life, that might not communicate well. So I think in order to communicate the messages across to the patients, the practitioner has to be a better listener than anything.
Awesome. Let's shift gears real quickly. We'll do a little bit of promotion here for you. Talk about your consulting and coaching business. Talk about who you help and who should call you.
Yeah, sure. I think, I do a lot of talks at conferences and events, but I also do a lot of one-on-one coaching too. I think anyone who's struggling to communicate better with their patients or with their team, that's someone who should reach out to me and talk to me. I have been doing it for a long time. I have been teaching it for a long time. I have been very successful, and I'm not trying to toot my own horn, but I have been very successful in dealing with people. And I can, I've worked with patients that say that they don't have the money, they don't have the time, they don't have this, they don't have that, they can't. And by the time I'm finished, they're reaching into their wallet, pulling out their credit card, asking me, how can I get started?
That's right.
There's a process to that. And it's not about the money. It's about wanting to do a good job for your patients, because nothing feels worse than knowing you didn't do a good job.
Yep.
Knowing that you could have done more and you didn't. So anybody who's feeling like that, who feels like, they need to do a better job with their patients, they really want to help them, those are the types of people who should call me. If you want multiple locations and millions and trillions and oodles of dollars, sure, I can talk about helping you, but I really like to help people that like to help people. So that's really my niche.
Yeah, that makes sense to me. What's the best way for our listeners to get in touch with you?
I think just email me directly. I just have a personal email. I don't have any fancy websites. I select to work with people case by case. So just email me at drlesleypascoe@gmail.com. All lowercase, no periods. You email me there and I'll get back to you.
Thank you so much. Dr. Pasco, thank you for sharing with our audience. We appreciate you.
Yeah. Thank you, Patrick. I really appreciate you having me on the show and for your interest.